I'm so thankful that I had watched your YouTube videos and other helpful YouTube videos because when I went to my healthcare providers, I was told there's nothing that can be done, just learn to live with it. If I had not heard from Treble Health that that's not true, I would have been devastated and in such a terrible place. So when I went to my general practitioner and heard, "Oh, you just need to learn to live with it." And when I went to a local audiologist who was like, "Oh, you have a hearing loss. There's really nothing that can be done about it." I would have been devastated, but I knew, no, that I will not believe that. I know something can be done. There's evidence-based treatment plans that work. So, yeah, Treble
So let's
Health.
go deeper into
Yeah.
that. Let's go deeper into that because you did find things that worked. So what is your message when if you were to tell those doctors, "Hey, actually you were wrong. I did find something that worked for me." And you can share, did your tinnitus volume improve? Did it decrease? Did it change? Talk to us about the actual real world results you got.
Mhm. Well, I have a good relationship with my general practitioner, and a really quick story is he does a lot of work with med students, and when I went to see him when it was horrible, I was in a very dark place, a med student came in before I met with my GP, and I said, "Yeah, I'm having tinnitus, and it's really kicking me in the butt, and I'm having a hard time moving forward." And this young man said, "Oh, I I don't wanna share too much personal, but I also have tinnitus, and it started I think I was listening to music too loud, and I've had it for 3 months, and I'm in a dark place too." So I was like, "Oh, wow." And then when the general practitioner came in, my doctor said, "There's nothing that can be done." I was trying to advocate for this young man as well, and I said, "That's really a harmful thing to tell people." So I gave him resources. I gave him your website. And I said, "Please share this with people. There's so much that can be done."
So let's jump into how you reduced and improved tinnitus over time. The data that I saw showed a significant improvement, and I'm really excited to hear your personal story. So, where are you today? And could you give some context of where tinnitus was at its worst and the kind of changes you experienced over time?
Mm. Yes, about a year ago, tinnitus started. It seemed like it was overnight, but when I look back, probably had been having little bouts of it for 2 weeks, 3 weeks before it came on full time. Before it started, I had been dealing with some really tragic things going on in my life, not just one of them, but a few of them, and I was also dealing with chronic stress. And I think that in combination with my mild hearing loss, more significant in the high frequency range, I was a perfect candidate for tinnitus. So when it set in, oh, it turned my life upside down. And I had been dealing with insomnia before it came on. And so I was in a really very dark place, Dr. Ben. I wasn't sleeping. I couldn't eat. I was in constant fight or flight, freeze mode, just constant. So that's where I was when it started. Fast forward to today, after working with Dr. Ramsey and Treble Health, I am enjoying life more than I was before tinnitus. I'm a different person now.
For those who are listening who are in a challenging place with tinnitus, who would like to reduce the volume and improve their life, what's some advice you have for people, based on your story? I think just talking about the actual challenges that you went through and how through each of those challenges you found tools or resources that helped improve them.
Yes. So everything in my daily life was a challenge. I didn't know how I was going to move forward. I was really fight, flight, totally in panic mode. I couldn't, I stopped. I'm an introvert as it is, but I completely stopped living life. Although I maintained work, I had to continue working. So that actually was very, very helpful to keep working. I don't know how I did it, and I did it successfully, but I think one of the things that I did, I went online when it started, and Really, Dr. Ben, one of the first things I saw was your 7-day meditation challenge. Thank goodness that's the first thing, and I thought, I will try this. I'm gonna try anything. And I think they were like 20 minutes long, maybe a little longer, and doing that for 7 days gave me 20 minutes of relief each day. That was the only relief I think I had. So, I thought, "Oh, I the meditation was so helpful." I probably listened to that, I don't know, dozens and dozens of times, very helpful. And I've done some meditation in my life, so I thought, "Okay, meditation's good." So I started working that into my daily living. I don't sit still and meditate. I loved your meditation because it was kinda doing some self-talk, so I did walking meditation or body scan meditation. And I connected with Treble Health, fortunately, within a couple weeks of the full onset, and so just knowing that I needed a sound-rich environment, and so I started listening to nature sounds or Dale Snail, love his sounds, and carrying my cell phone with me all the time with whatever sounds help me out. And then I connected, had my free consultation, and within it like a day, I think I called, was hooked up. Within a couple weeks, I decided, yes, I want to do this program and get the maskers. And with the hearing loss, I got the hearing aid component as well. So it was a no brainer for me to do this. And it just was within I'd say 3 weeks, I was connected with Dr. Ramsey. And with her, we developed a great treatment plan with a lot of helpful things. So the sound rich environment, absolutely helpful. And the maskers immediately gave relief. Just took the edge off this horrible anxiety I was having and helped me get through the days. So, and as time went on, the neuroplasticity of the maskers, it's wonderful. I don't even know words to say how helpful that is. And then I didn't take on too much. Initially, when I developed tinnitus, my first thing is I just need to get rid of it. I don't know how to get rid of it. It has to go away completely, but just to kind of relax into it and pick a couple self-soothing things to work on. Don't pick too many things and get scattered. Just stay focused on those and stick with them.
And then you described the maskers. Those are also referred to as sound therapy devices that go in the ears. Sometimes they can also be hearing aids that are programmed for tinnitus treatment. So, could you explain to us what you mean by maskers for those who don't know?
Absolutely. And for me, I opted for the hearing aid component as well because I have hearing loss. So it's just the little devices you put in your ear and it blows whatever sound you want. You work with your audiologist to pick sounds that are pleasant to you or at least you feel neutral about. So I picked something that I use most of the time was a Zen sound, just a light blowing sound. I use some waves as well. Yeah, and it that's what the sound, the maskers are. Just gives you a different sound. I didn't necessarily focus on it, like, "Now I'm gonna focus on that." It just was there and cut the edge, so but also, I it's a hearing aid for me as well.
Talk to us about your actual experience of the sound today. How is it different than when this was at its worst? How aware are you less aware of it? Is it a lower volume? I think we're curious to hear that.
Oh, absolutely. When I started, it was I never could put numbers. I just didn't want to, I stayed away, but it was loud. And it fluctuated a lot, and so I never knew day to day, like, is it gonna be a bad day or good day? Totally don't think that way anymore. That's detrimental thinking. Very loud, very intrusive. It's all I could think about most of the time. I think probably when it came on, it took a couple of months for it to change, and I worked hard with Dr. Ramsey, and I really worked hard. Right now, today, while I'm talking to you, I don't notice it. I could probably find it. The volume's gone down. The fluctuations totally have changed. Probably since I stopped working with Dr. Ramsey 3 months ago, I've had maybe 3 days where there were an hour or so where I thought, "Okay, that's really annoying. I need to do some self-soothing." So, night and day difference. It's
Well,
there. It doesn't affect my life at all.
well, I think that's an incredible message that, if tinnitus, say, can improve 50%, 80%, which happens a lot for our patients in our community, that is a life-changing experience for many people. So it's very different from this narrative of there's nothing that can be done. And what those doctors are actually trying to communicate is, I don't have a medication, I don't have a pill, I don't have a surgery, I don't have a surgical procedure to fix this for you. So I can't do anything. But you, the patient, you, Annie, you can do things, and that's what you learned. You learned how to do them, you know, in a professional program as well as part of a tinnitus treatment protocol, which certainly streamlines the process. Any last comments or words of hope, encouragement for those listening with tinnitus that, like I said, even a 20% improvement would make a big difference in their lives?
I think to be able to conquer the fears, I think fear kept me in a place where I didn't need to be as long. So to be able to know it will get better, it is going to get better. And evidence shows it won't get worse. If your hearing changes and gets progresses, it doesn't mean tinnitus is going to take over your life and be horrible. So to be able to conquer the fear and to accept for now tinnitus is with me for now. I'm accepting that. It's annoying sometimes, and I'm going to go out and have fun with my friends. And I'm going to live a rich and meaningful life.
If you follow Treble Health and get value from these videos, I would highly recommend that you watch the full video from this clip right here, or subscribe to this clip's channel. Every little bit counts, and your support means the world to me. This is Dr. Ben Thompson with Treble Health.